Tonight's headlines are brought to you by McDonald's.
Here with Governor Torres. Vaccine came in this morning. How did it make you feel?
Well, what a relief, but also just considering what we've been through in the last 9-10 months, the sacrifices that our first responders, our community, our healthcare, our economy, unemployment, high rate. I mean, just looking at this one box, like, this is our savior in the next several months for the entire CNMI. Really just a overwhelming feeling, and we're already at the very end of this race, so to speak. And so if we can continue doing what we're doing, we'll definitely be in a good position to have everyone safe. So yeah, exciting.
The CNMI, Saipan, Rhoda, when you look at the rest of the United States and most of the territories, you got to be happy with the way things have gone here. I mean, the economy is devastated. Tourism is like starting over, but health-wise, we're in pretty good position.
Yes, sometimes when you see others, unfortunately, when we look at around the world, what they're going through and what we're going through here, that's when you appreciate all the hard work that our community has put together, our first responders, our task force, our CEO, Esther Munia. I mean, sometimes you gotta see the other end to appreciate what we have here. With economy, tourists, everybody around the world is suffering. But because of our low rate, because we have flattened that curve, we are able to utilize our other resources in a better situation. For example, we're rolling out our vaccine. Our nurses and doctors don't have to worry about, positive cases that are in ICU. We don't have to worry about patients being in ventilator for COVID, because we don't have community, based spread. Our limited resources are functioning what their normal job work is doing. So we're very fortunate of that, and we are able to do other things now, moving forward with the new norm of tourism, the new norm of our life. Having the vaccine give us that hope of one day going back to our new norm where we were before.
There's a tourism corridor proposal that we talked about at MVA meeting last week. Your administration and the government is behind this plan. There are people that will say, hey, the vaccine is here, why not wait another 2 months, 3 months? What do you think about that?
Because, and I understand those concerns. For us, it's not just opening this, it's understanding what the new norm of tourism. We've been through this. And one thing I'd like to ask the community is this: is our system, the system that we have, is it working? Do you believe in that system? If the answer is yes, then we're taking the same system to this new travel bubble, right? So there's flights that's coming in. United Airlines is here, right? And if what Korean airline that comes in, or whatever that airline, there's no different between passengers coming in. Their category, whether you're a tourist, whether a returning resident, business opportunity, you're still a passenger coming in. So that's why it's important that our community understand that the system we have, that's headed by our CEO, Esther Munya, COVID Task Force, our first responders. That system worked. And it's very important that we understand that and we embrace that. So for our tourists coming in is understanding the new tourists. What is the tourists coming in? What do they expect? What is our community expectation? With the corridor, I believe that we've addressed those concerns, at least for the first 5 days, just the same way United Airline passengers come in, they are treated the same way. So I think we've addressed those concerns, and that's why I'm comfortable, and I look forward for the rolling of the first, kind of like an inaugural flight, right? This would bring hope for all of us that the new norm is here, and it's a complement with the vaccine coming in. Even with the vaccine issue, some folks don't want to take it. We've been bombarded with so many phone calls that wants to take the vaccine, which is a good thing. But again, just the vaccine itself, you have people that don't want to take it. You have people that are concerned about taking it. But we do have a plan, and we are rolling out the community campaign in why we should all take the vaccine.
Since the tourism corridor story was delivered to the community, have you heard any misconceptions? Have you gotten any feedback? You want to address any of those?
Well, so far, the business community are anxious to see that. So far, everyone that I spoke to is excited about it. We have some questions and concerns, but when those questions are addressed, they're comfortable moving forward on it. And I think just understanding the whole process would give the community a comfort that it is safe. There's no community involvement into this, at least for the first 5 days. Again, no different than the system we have. And we want to offer this same system with any other company. So this is not just catered to one company. It's a system that we're trying to open up as a new norm. If it works perfectly, then excellent, we can emulate that to other companies. If it's something that we need to address and make it better or stronger, then we'll work on that. But until then, we need to bring back the new economy, the new system, the new tourism, the new life on us in the CNMI. But again, moving forward, we've done so much as a community, all of us. And it's important that the last stretch of this, we continue to hold hands and continue to fight COVID with each other and not against each other.
With the vaccine, the rollout, who's going to get vaccinated? Who's going to be the very first person to be vaccinated?
So I got the honor, and I know our CEO will be here. She's here, but it'll be nurse to nurse, and that's the process. And I know our CEO can make that statement. But I know that I'm probably one of the first batch in taking this, and also to encourage our community that it's important that we take this vaccine.
You said you've gotten a lot of phone calls from people that want to take the vaccine. You've also probably got some questions. What are the biggest questions that you're getting about the vaccine?
What are the side effects? What are the health issues? Whether to take it or not. If you're diabetic, is it okay to take? If you're in dialysis, is it okay to take? And so we have those frequently asked questions, and that'll be part of our call center to address those concerns. But we'll be rolling out a good community-based outreach on the pros and cons of not taking it.
Okay. Our economy, what do you think, what's the timeline for things getting back to the new normal?
It's going to take a while. I mean, I'm optimistic that we are in a better position than other territories and perhaps even other nations. But at the end of the day, it's not just us, right? It's our tourist destination. Like for example, Korea. What is their regulation? Japan, for example, as well. So, but what makes us unique and in a better position is our low turnout, of course, our fatality. The system that we have is working, and our community is behind the directives. And that's what something that other communities and other territories, other states don't have. So this moving forward with our economy, it's a collaborative effort. And I'm very optimistic moving forward that if there's an opportunity for our tourists to come back, we'll be one of the very first to embrace that.
The casino industry, having a tough time before COVID, and then COVID happened and the doors were shut, and we've seen lots of fallout since then. Do you think that IPI survives this? What's your administration doing to address the non-payment of not just taxes but license fees and payments to workers who are stuck here? Some of the CWs have expired. They don't have tickets home. We see sort of just a lot of unknowns in that area. What do you think?
So the first thing is, we want to help every company here in the CNMI. Being at that with IPI, they have obligations that they need to meet in order for us to move forward in the right direction. I know that they're having some issues. We see it, we hear it. So we are working with them in making sure that in order for them to move forward, they need to address the pending issues. And of course, like what you said, taxes, and of course the labor force, the construction, all of that needs to be addressed before having that industry back online.
Has anyone from IPI, we hear the name Mr. G, and we hear the mother who is here, but any of those principal players, have any of them back channeled to you or the administration and said, hey, look, we're going to take care of these obligations, we're going to make this successful? Or is it really an arm's length kind of relationship at this point?
Yeah, I haven't got any communication with either of them. More of the communication is through CCC on what they're being updated from them. And then once in a while, any update from the Lottery Commission. Again, that's just what we see and what we hear out in the media. But in terms of any direct, I have not gotten any direct communication with them.
Okay. Is that disappointing to you that you haven't gotten any private assurances, or is it just the way that it should be?
Well, I would like to see if there's any update. Since even before COVID, a lot of their management has shifted. So I don't know who's the executive order. I haven't met with them on any update on who they are or their new organization. So I think I'll be happy to see the new organization, happy to see new approach, and perhaps what kind of arrangement that they need to do. I know that they've been working with Secretary of Finance. I don't know specifically who they're meeting, but I know that they're trying to address those concerns.
Do you think that what's the next step in that relationship? Does the DPL hasn't been paid for their leases? Is there a receiver that gets put into play that sorts this out? Do you give the casino license and an unfinished hotel to another group, or RFP it? How do you see it playing out?
I think there's some legal issues in them, but I expect that if DPL has issues, that DPL address those concerns. If finance have issues, then finance needs to make sure that their issues are met. And I believe that altogether, it has to be met. If one department, whether it's public land, public works, or finance, those needs to be addressed before moving forward. In terms of selling and or whatnot, I hope that IPI can take care of what needs or the pending issues. I know they've invested here so much, and I would hate to see those kind of investment go down the drain. And I hope that they can address those, whatever the issues are, whether it's taxes, back pay, wages, lease agreement, lease payment. Because if the new company comes in, those issues are still going to be there.
Right.
So it's important that this company knows that there's regulations that needs to be met, there's fees that needs to be paid, and there'll be no different than any other company coming in.
Great customer rep, always willing to go above and beyond for his customers.
I truly hope she gets noticed at work, since I do see She is a hard worker.
The field technician that visited my home was great and helpful. Thank you.
Thank you. Uni, keep it up.
Your customer service is always very good.
Awesome customer service with great technicians that are really helpful.
Thank you so much, Sherlyn and Docomo Pacific.
That's so sweet. It feels good to see this kind of messages because we try our best to do customer service.
We make sure that we will 100% resolve the issues.
For all those people that are seeking assistance.
I just want my customers happy.
And help them out each and every day.
I would want to go to a place with someone that's just like me.
Thank you.
Thank you.
Come to Docomo and you'll feel like you're at home.
Across the nation, more and more people are driving under the influence of drugs. The CNMI Department of Public Safety would like to remind you to drive safe this holiday season. Do not drive while under the influence of marijuana, opioids, methamphetamines, or other potentially impairing drugs, including prescription and over-the-counter medication. These drugs can impair your driving and can put you and others in harm's way. Be responsible this holiday season. It's not just your life at risk, but the lives of the people around you. Don't let one poor choice ruin the holidays for you or your loved ones. Drive safe this holiday season.
Brought to you by the National Highway Traffic Safety Administration and the CNMI Department of Public Safety.
Remember, if you feel different, you drive different.
For all those going out each day, doing what they can to hold us all together, we're here to help those helping us all by keeping our lights on.
With the new administration, Biden administration preparing to come in, does that mean anything different for us in terms of the vaccine rollout, our plans, or have you had any communications with the Biden-elect transition team? How does that work?
I have not gotten a direct call from the new transition team. I know that some of the current federal partners are part of the transition team. But I'm sure that soon I'll be communicating with the transition team. I believe that with the rollout with the vaccine, I'm sure that they want to vaccinate our community as soon as we can. I know that those numbers are limited. And that's one of the reasons why through Esther Muñoz, our CEO, the task force, we've worked so hard to do what the regulations are, what is expected for us to move forward in order for us to get the allotted number. So there's a lot of things that needs to be met, cold storage and cold center and some other stuff. So we are in a better position to ask for additional vaccine moving forward because we've met all the requirements through CDC. So I hope that what we have showcased in the last 9 months and what we're showcasing today would give us that better opportunity to get our vaccines here. And I look forward to that.
Has the task force given you a timeline of when they expect to have everyone here who wants to be vaccinated, when that will happen?
The answer is there's no exact time frame because, to my understanding, it all depends on when the vaccines are available. But I know that through what the discussion we've had is they go by increments, whether it's 6 to 8 weeks. Again, we have Pfizer today, we have Moderna, and I believe there's also another company that's coming up into the pipeline. But what's important here is that we have the task force, we have our CEO, the hospital, the first responders. What's important is that we have these elements, this component that gives us the best opportunity to get additional vaccine in order for us to roll that out to the community. That's very critical because we can get all the vaccines in here, but if we don't have the right logistics, if we don't have the right people manning this. So we've worked through the whole team the last 9 months. We know that this system is working. We are implementing it again through this new vaccine process. But I'm very optimistic because I believe in the group that we have.
Will you have some requirements for government employees who maybe for frontline workers, maybe for bus drivers that are driving kids around? Will government employment be conditional upon taking the vaccine? Have you talked about that?
I would first of all encourage everyone across the community, regardless on what your race, regardless your age obviously has if you're an adult. But for me, if you're able to take it, please take it. And I know there's priorities, first responders and so forth. But at the end of the day, yes, I would like to encourage all of our government employees, whether you're a bus driver, whether you're an accountant, or any position that you hold. It goes both for our government employee, our private sector, and just out in the community. So I really do encourage this. We've been talking about vaccines since day one, that we need to stick together, we need to do all of this, distancing, proper mask, until the vaccine comes in. This is our new norm. So now that the vaccine is here, please let's take advantage of it. We've worked so hard in maintaining low number. We've worked so hard in flattening that curve. We spent a lot of time, sweat, sacrifices. Now that we're here in the end, let's take advantage of that. And I take it the same way when we started this. You wearing mask, I'm wearing mask, we're saving each other. Now that the vaccine is here, it's the same approach.
As of now, not looking at making it a requirement of employment? Is that fair to say, or is it something that's still under discussion?
Right now it's not a mandatory, but I would definitely, I would like to meet with our Attorney General and see where do we go from here. But at the very minimum, I would definitely highly encourage everyone to take it. And if I can make it a mandatory, I will, only because it will save life. I'm sure that those have gone through, that has left this world on COVID, if they had a choice, I would guarantee you that they wouldn't blink to take this vaccine. So I don't want to wait till it's too late. It's here. And I hope that they take this consideration seriously, to take the vaccine. And I hope if I get opportunity, I'll take it too.
Rhoda, Tinian, Saipan, starting on the same day for first responders, or how will that work?
That would be a good question for the task force.
Okay.
But what we're doing is that we're trying to go to Rhoda next week, and then we're setting a schedule for Tinian to do the community campaign on what to expect on this vaccine. And I think the task force would be the right person to roll that out on that, or our Esther Muña, our CEO.
Okay. Anything else, Governor, that you wanna stress or emphasize today?
Sure. Can I?
Yeah.
I want to thank all the community. It's been a long 9-10 months of sacrifices, commitment, and just the whole emotion that each and every one of us, and no matter who you are, no matter what your nationality is or your religion, we've all sacrificed the same, some more than others, like our first responders. But from the bottom of my heart, my wife, first Lieutenant Governor, his wife, I want to say thank you for everything, all the community support, whether it's the first curfew that we did to yesterday's executive order or the directive. And I say thank you from the bottom of our heart for the greatest community that anyone can ever live. We are at the lowest rate because of what we have done together. Thank you for first responders, your family, our nurses, our doctors. I want to say a personal thank you too to Esther Munya, our CEO, for an excellent job in maintaining our hospital's normal work, as well as moving forward and accepting and moving on the alternate care side. I want to also thank Warren Villagomez, our chairman for the task force, for all the things that he's done in the last 9-10 months, as well as everyone that has worked on this COVID-19. Goes out to Patrick Guerrero, our GAR, and also Gerald Guerrero for Homeland Security. Everyone that has helped, but most of all, to our community. Thank you, Noklin Susmasi, za stigin natin pun holiday, kasi natin pun Feliz Pascua sa Anim Rebo, malazata utsun istinasakan, 2020, za ta na molik mo na karirata, za ta utsun istinasakan, za Noklin Susmasi ni todo bendisyon, za ni commitment, za ni gunay za mizo todo, ni ta utsun isti 2020 za ta COVID, za ta babas ti mamala nasakan, za ta na mas medgut, tan fit mi gunay za, kanang pendi za pinasensya. Si Jesus masih za ta na safu mo na karirata todo. Thank you.
Hi everyone, welcome to Pacifica Reacts. This is our annual Pacifica Art Contest. We had over 1,500 entries to date by local young artists ages 6 to 17.
Winigi Pechay Pharmacy in Gofadahi, Ihinim Lomo.
Our complete line of pharmaceuticals and lowest prices ensure you get the treatment that you deserve.
Our compassionate, friendly, multilingual staff will take the time to get to know you, explain your medications to you, and answer any questions that you may have.
Nyere eyor sumaye uhalweres ren, kutsu wayor sa feye emal ebalisiu tlalyam wires.
Inumin ang inyong gamot ayon sa nireseta ng inyong doktor at alinsunod sa bilin ng inyong parmasutiko.
We accept most insurance, but in case you don't have coverage, we offer cost-effective generic drugs.
PHI Pharmacy, your lifelong partner in health. PHI, the pharmacy you can trust.
A meal replacement smoothie is a great way to keep your fitness goals on track during the holiday season, and they taste great, fast, and easy. The December smoothie of the month is Minty Java Choco Chip, and it's just $5. Check out the Shake Cafe, Gold's Gym, Garapan. All right, task force, thank you for coming in. Big day in the CNMI today, a day that it's been a moving date as far as when the vaccine is going to get here, but I know lots of preparation has gone into it. I know you guys are on calls every day with the rollout plan. Vaccine came in this morning, came in successfully as far as we know. What's the next step? And I'll just start with you.
Sure.
What happens now?
Okay. Well, the next step is to get those vaccines to the arms of individuals that are going to be vaccinated. So get them what they call shots to arms. So we're going to get that rolling starting Saturday. We are going to start with the healthcare workers, and then we are also going to be including leadership, like the governor and just leaders to kind of push the campaign out to that these vaccines are safe and effective. Yes.
We've seen some polls with healthcare workers in the U.S., and there's some healthcare workers that are questioning whether they're going to take the vaccine. Do we have any issues like that locally, or are people ready to lead?
Yes, we have some. We are hearing those, but again, you know, as CHEC is the leading agency for protection of public health, we are looking at our current policy to ensure that patients look up to the leaders in the medical field to give them the advice of what's best for them. And this vaccine, the vaccine is to save lives, right? So that's one of the things that we need to encourage people to think about, you know, so that they can sign up as well and take the vaccine.
I asked the governor this question about government employees and whether there was going to be any sort of requirement for employment. We've heard some private companies that have said that they are going to require vaccination to work there, especially companies in the tourism business where there's people coming and going, hopefully in the near future. Any requirements being pondered for healthcare workers to be vaccinated?
So that's we're working with the legal counsel to basically finalize our policy for that.
Okay.
Yes.
Let's talk a little bit about the nuts and bolts. How long, and maybe Warren, I can ask you this, how long will the vaccine take to work? If I get the first shot and I need another shot 21 days later, do I get some protection right away, or how does that work?
I mean, the science behind it is your first dose. It's not entirely clear until you get your booster, your second dose. That is when your protection kicks in and starts being effective.
Okay, so I get a shot, and then are we scheduled? Does it have to be 21 days later, or is that just?
Yes.
Okay.
21 days.
Okay.
Yes.
And if you go a little bit longer, is it okay?
No, you gotta restart. You gotta retake from day one.
Oh, really? Okay. Wow. Will it hurt?
You know, I mean, it's basically a shot. You know, I'm one of those people that are afraid of needles. So, you know, yes, it will hurt. You will get symptoms of headaches, fever, sore arm, of course, and body aches.
Fatigue.
Yes.
If somebody's had COVID, we have 100 people or so in the community that have had COVID. We may have more because we may have had people that had it elsewhere and then came in, tested negative. Do those people need to get vaccinated?
Yes, they do. They do. So right now, the study doesn't show enough. I mean, there's not a lot of information about how effective your antibodies are when you have COVID. So it'll be short term. Right now, that's the studies showing that it's short term. So, but this vaccine is actually showing to be more effective than the antibody that you get if you did have COVID.
Warren, who should not get vaccinated?
Who should not get vaccinated? Everyone should get vaccinated. In the community, there are medical discussions out there for immunocompromised folks, women that are expecting, you need to consult with your medical physician or medical care provider to make sure that you're good to go to accept the vaccine.
Right. Some people have allergies, the components of the vaccine, if you have allergies to the components of it. So it's advisable that you don't take it. And of course, it's the discussion between you and your provider.
You talk about provider, a lot of, we sort of talk about CHCC as being the main provider, but any agreements or discussions or deals made with private clinics to help with the vaccination?
Yes, thank you, Chris. And with the effort of Governor Torres and CEO Muñe, the governor had reached out to the private clinics, the private pharmacies, the two pharmacies we have on island, to sit on the same table and collectively engage the action plans that CEO Muñe had put in place, as well as a task force to conjoin the efforts of our next steps is getting the people vaccinated.
Yeah, it'll probably be after, which is the Moderna shipment, because it'll be easier to transport versus the Pfizer vaccines.
So for people who are getting caught up on this, that vaccine, which has not been given the emergency use
Correct,
authorization.
yes. We should be getting it this week.
But anticipated.
Anticipated, yes.
The storage, the cold storage requirement is easier than the Pfizer.
Correct.
Okay. Yes. Meaning a private clinic could maybe have it stored in a way
it's
that
possible.
is
Yeah.
not. Okay.
It's a requirement.
How about children?
Not yet. There's Johnson & Johnson, and basically there's others that are trying to do the trials for kids. And Pfizer actually did start for the third phase, I believe. So, that's a possibility. Once we have enough information about it, then they're going to be giving the authorization for it.
Pregnant women that are breastfeeding.
Studies right now are saying that it's still safe. So, but again, that's a discussion you should have with your provider.
So if a woman's breastfeeding, that means her child is sort of getting the vaccine. Have there been any studies on that?
We're going to opt out on that one.
It's not clear.
Don't know.
Consult with your medical provider.
Okay. Older people?
So the vaccine is supposed to prevent, if you get the COVID, it'll prevent you from having a serious illness.
How about older people?
So the vaccine is supposed to protect you if you get COVID, that it protects you from having a serious illness. So this will be very, very helpful. That's one of the reasons why we are urging individuals that when they're called upon, it's their turn to take the vaccines, we would hope you could step up and take it. And, this is it'll take a lot of contribution from everyone in the community to get us there, to help save lives.
Is there going to be a fee for the vaccine?
No.
Is there going to be a citizenship requirement? The reason I ask that, if the vaccine is available more widely here than elsewhere, do you see the possibility of people traveling here so that they can be vaccinated?
Let me go back to the fee. So the fee is, if you do have insurance, we will bill your insurance. But at the end of the day, if it is going, the ultimate goal here is that no patient will be burdened with the cost of this vaccine. So if your insurance denies it, for example, you will not have to pay for it. But it is, Medicare did approve for billing for this, and so we are going to attempt to bill for the administration. Let me just clarify. It's the administration. It's for the cost of the staff that are going to be administering the vaccine to you. The vaccine itself is not going to be charged to anyone at all.
Okay. Yes, what's the administration fee going to be?
I'm not sure. It's about $10 to $30. But it's billable to insurance. We're not charging it to an uninsured individual.
I see.
And that is one of the infrastructure that the task force took on to make sure that vaccine administration, potential charge that could be billed to the insurance company. We have that infrastructure in place along with all other necessary medical link towards CACC and the administration during the time that we get out to our general population.
And to add, as I've read too, if it's not billable to an insurance company, so an uninsured person, that could also be covered under FEMA's reimbursement back to the provider. So in this case, if there's, those will be eligible costs that we can cover as a reimbursement.
Buy one, get one free for the off-road adventure at Marianas Trekking. Come ride our side-by-sides at our best price ever and experience a great 90-minute trail ride. Rain or shine, hopefully rain. Book now at Marianas Trekking. Saturdays and Sundays by reservation. Call 323-8735 or book at marianastrekking.com.
Come, take your turn at the most unique restaurant on Saipan. Daily lunch specials are just $9.99 and come with soup or salad. Happy hour starts at 5 o'clock. And dinner features spectacular sunsets and great food at reasonable prices. 360 can be chartered for parties, events, birthdays, and weddings. Make it special. Make it 360. The best food and view all the way around.
Thank you for being here with us.
For finding ways to keep things happening.
For making things feel a lot better.
Thank you.
Energize, realize, feels so good just to be alive. Time's a gift, my time is free. I can spend it on you, you can spend it on me. I could say you'll be blown away, but the change you see me. And I feel alright, dance all night, put a little flavor in my life.
Thank you for staying strong with us.
And for us.
Thank you for always connecting.
For keeping us together.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you for reminding us
that despite this distance,
we are still better together.
Docomo Pacific, better together.
Patrick, you've been instrumental in figuring out how to get things here, how to get them either paid for initially and reimbursed later, how to get them from Saipan to Tinian to Rota. What are some of the biggest logistical challenges that you've had to figure out as this pandemic has raged?
I'm still trying to figure out how to get fresh romaine lettuce to pick up fresh romaine lettuce from the grocer. Logistically, where we're located is a challenge for everything, and even more so during a pandemic when not just airports but seaports shut down. operations because the whole country goes on a lockdown and whatnot. So with some experience from past disasters dating back to U2 and Solor, we went with the private contractor, signed contracts with them, and we know they ran their own planes and could go pick up wherever we needed stuff from. So was identifying and working with public-private partnership to do that. That's how we kind of did it.
I mean, interesting to me to see a plane come in that I know usually transports tuna from the Federated States of Micronesia, and it's bringing in coolers, refrigerators from Korea.
Right.
So,
not to get into too much detail, but I used to travel a lot, quite frequently, to all of the islands in Micronesia in previous work, and I saw those same planes doing the tuna run. And when we get hit by disaster, the first thing you think is, well, in this type of disaster, is they're probably not running tuna right now. Let's see if they can go pick up our medical supplies and PPEs or the freezers, which we brought in a couple weeks ago, and it worked out. Some people they wanted their companies to keep running, and we needed their service, and it was an easy working relationship with them.
what's been the most challenging thing for you in this process?
Finances, of course. The state has to put everything up front and then claim as a reimbursement later on from a federal agency, whether it's FEMA or HHS or any of the other agencies in supporting the CNMI government at this time. And when you don't have much to begin with, as everyone knows and everyone's feeling out there, the challenge starts there. But assuring our vendors and suppliers and working with them again from previous disasters, we were able to, sort of help each other out in that sense. And I got to give or take my hats off to the Secretary of Finance. He found ways for us to make payments when we had to, because we were competing with the rest of the world, really. And if we didn't at least put something up front, then it went to the next, next in line, or and so forth. So, all right.
Yeah, he was excellent with that. I mean, back in March when we were watching the news, what's happening in New York, and to have that assurance that you're going to get your supplies and PPEs. I mean, that was amazing. And we were in this process, actually responding to COVID since around December, January, and we've been ordering. And basically, every time we submit an order, they said we don't have any. So having to access that was really helpful.
Access and finding the vendors out there to commit for, to supply the needed equipment that we had put out for interest. So it's great. Hats off to Brad Guerrero.
Yeah, I want to add that sometimes it's a non-traditional vendor too.
Yes.
We go to someone that's supposed to be a medical supplier, but of course everyone's going to a known medical supplier or PPE supplier. So they, sold everything on their shelves. And whoever says, hey, we have it or we could get it, I know somebody can get it, we kind of trust up front and say, okay, please, and then if it's delivered, of course, then we do good on our obligation to them also.
Okay. Back to the vaccination. Does the vaccination prevent both infection and disease, or is the jury still out on that?
It prevents you from getting having serious illness if you do get it. So, there's some that have gotten it, like we mentioned, or I don't know if we mentioned that already, but, that you would, even if you had COVID, right, you would still be able to get the vaccine. So, your antibodies are better with the vaccine.
So if the I read somewhere that you they don't know if you could still be a carrier if you've been vaccinated. So there is some thought that masks and some of the PPE stuff will continue at least for
Yes.
a certain period of time. Is that
That's
accurate?
correct. That's correct.
Yes.
Can you get the vaccine for COVID the same time as getting other vaccinations?
Not at this time. There's actually planning for that, but right now, not at this time.
Okay. What's the plan when we do the community rollout? What's it going to look like? Is it going to look like the airport system that we had before? What can people expect or get ready for?
That's what we were planning on, and it depends on also how many vaccines that we're going to be getting. So we are expected, I believe, about 400 for Moderna. So that obviously can only cover several people. I mean, not several, 400 people.
400 doses?
I'm not sure if it's doses. Let me just nix that on that one. Yeah.
Okay.
Yeah, but it will take, if we're going to do mass vaccine, it's going to be the airport. That's what we're looking at, right?
But yes, and that also will be determined by our infrastructure, our pre-registration, our survey that's going on now, our call center, being set up as we speak. So those are the triggers to our level of efforts moving forward. But we have tailorable plans that on our cache of vaccines, where do we and how do we facilitate and administer them.
What do people who are not first responders but watching this and getting ready for getting vaccinated, what is important to you that they know today, and when do you think that they will be, the general public will be able to be vaccinated?
So information keeps changing, from OWS, Operation Warp Speed, and CDC. So, go to the website, vaccinatecnmi.com. There's going to be up-to-date information about when it's available, and again, it's going to be when it comes to your turn. We're here to answer questions. There's probably some questions there that already answered at the vaccinatecnmi.com, because we are actually looking at compiling questions and answers we've already receiving questions, so we want to post those questions on the website.
Are you looking at sort of a lottery system or something?
No, the first priority is healthcare workers, right. And because we don't have long-term care facility, we are looking at the Manamku homebound individuals, vulnerable populations. That's phase 1. And then, for the next phase, we are looking at getting everyone registered, and upon registration, basically that's where, we hope that people can register, I guess, first come, first serve in some ways when it gets to that point already. Yeah, so, yeah.
That's the queuing when we open up for the general population, is basically having a registration caller take on your name on and set you on a number for a date for vaccination. So the campaign is going to be rolling hard to not just time, date, place, but education materials as well, and information and other good stuff.
Yeah, I'd like to add to that. I think to the last few questions that you were asking is dependent on how many doses we get.
Right.
Because Governor Torres wanted, if we had all the vaccines our population needed today, then we're not going to do 100 a day and right. take a whole year to do this. And that's why we partner with the private providers. If we had all the vaccines, then we want to do as many as we could on a daily basis. Yeah. And so if it makes sense at the airport, then hopefully the private providers are actually going to move up there and help us up there.
Yes.
Take a shift
right.
or take a full day. Then following day, another provider, CHCC maybe for most of the days, I would expect. But a whole community effort there's two phrases, I guess, during our discussions the last few weeks. Do we go fast and furious or slow and steady? And of course it depends on how many vaccines we can get, how many doses. And if it's, we're not going to be sitting we got freezers, but if we don't have to use the freezers
Right.
and keep putting it into the arms of our
Yeah.
community, our people in the community, then that's what we want to do.
Yes, I think that's the message that we got. I mean, discussed this with the governor, is we do want to go fast and furious. If we have it, we want to get it to the arms of the individuals who want it. So that's the goal.
How long will Kanoa continue to be used as a medical facility? Any idea?
As long as is needed,
Yeah.
that request comes from CHCC. I would say as long as we still are calling this a public health threat.
Right.
We know that we're catching a lot of cases at the border, so it's our best line of defense right now. The vaccine is another line of defense in combination while we wait to vaccinate most of the population. I think you're going to see it stick around when the masks come off.
Yeah.
That's probably when we will stop quarantining.
If you had to guess today when the masks will come off, based on the information that we have today, what would you say? June? July? August?
It's actually very close.
Yeah.
Around that time.
Yeah. So maybe the middle of next year. When do you think schools, we're not talking about vaccinating kids for COVID-19, but when do you think kids can go back to school? Our kids have missed U2 and Pseudolor, and now the pandemic. Our kids have missed a lot of school in the last 5 years.
It's not our decision.
Yeah.
That was we okayed for them to open. So
Yeah, we provided all the necessary guidelines for the schools, both private and public schools. It is actually decisions that are being made by the school, PSS management, and private schools. So the tools are there, the resources are there, and guidelines. There are concerns that they still have, and it's also costly for them to get to that level based on the safety aspect of protecting the kids in a classroom setting.
Anything else you want people to know?
Once
Yeah.
we get the information out for our COVID-19 vaccine, please go to our Vaccinate CNMI 682 SHOT, SHOT. We have people standing by on a daily basis to answer your calls, 7 a.m. to 10 p.m. And that would be also out on the paper, media, radio stations when it's actively available.
yeah, I guess I can add that I think we try to do all of us should try to do our part and ask questions about the vaccine, get informed about it, and and if you can, if it's recommended by your provider, please let us know, and we'll get the shots to your arms, because it's like Patrick said, it's our second line of defense, to try to continue to get to recovery. So look us, go to vaccinatecnmi.com.
As much as we say thank you to the community for all the patience they've, and sacrifice that they've done to keep our cases low, the vaccines are here, and I know it's exciting. We were at the airport early this morning, and probably with
goosebumps,
goosebumps, chicken skin, and but I think we need to still stress the message that we need a little bit more of their patience as we get this rolled out. They're here, but we're piecing together a lot of information, and we don't want to start running right away. We want to make sure we're doing things right. A little bit more time. Even with the call center, we're putting it up. We're getting people trained to take in registrations for people that will be vaccinated. You're going to need to register. And we need a little bit more of the community's patience in that too. Everyone has a lot of questions. There's really good websites out there. We'll try and link them to Vaccinate CNMI, as CEO
Reliable
Munoz
ones.
said. Link to, CDC and other HHS websites to get the right information. But as soon as our call center is up, give us a call and we'll try to answer most of your questions and start registering people to get vaccinated.
Right. Yeah.
Thank you so much for your time today. As a not as a journalist and as a community member, I'd just like to say thank you to all the hard work. And I know, you know, I see Warren all the time, so I see the amount of work that, you know, the multitasking that goes on into, you know, the last 9 months. I think that you guys probably, I hope in 6 months you can go on vacation somewhere and just chill and not have your phone ring for a couple of weeks.
Yeah,
but I know the community really appreciates the efforts, and there was like some learning curves along the way, but you guys learned fast, and it means a lot of saved lives, and you gotta be we're all thankful for that, and you gotta be proud of yourselves for that, so thank you.
Thank you.
Thank you.
Thank you.